What is insomnia? Insomnia is more than just occasional sleeplessness. It is a chronic sleep disorder in which the normal sleep cycle becomes disrupted, making it difficult to fall asleep, stay asleep, or return to sleep after waking up. Medically, insomnia develops when the brain's sleep-wake system becomes imbalanced due to stress, anxiety, irregular routines, or underlying medical conditions. People may lie in bed for long periods unable to relax because their brain remains in a state of heightened alertness. Hormonal changes, excessive screen time, caffeine, and certain medications can further interfere with the body's natural production of melatonin, the sleep hormone. Over time, this results in light, restless, or broken sleep that never feels refreshing. Insomnia also affects daytime functioning, causing fatigue, irritability, poor focus, and reduced work performance. In severe cases, chronic sleep loss weakens immunity, increases blood pressure, and raises the risk of heart disease and depression. Many individuals develop a cycle of worrying about sleep, which makes the condition even worse. Shift workers, students, elderly people, and those experiencing emotional stress are more vulnerable. Lifestyle factors such as late meals, irregular sleep schedules, and a noisy or uncomfortable bedroom can also contribute. Early recognition, proper sleep hygiene, and medical evaluation are important to prevent long-term complications. Treatment may include behavioral therapy, reducing stimulants, relaxing the mind before bed, and using medications only when necessary. Types of insomnia. 1. Short-term acute insomnia. Usually lasts a few days to a few weeks. Often triggered by temporary stressors such causes as exams, work deadlines, relationship problems, or sudden life changes. Though short-lived, it can make daily activities harder due to fatigue and irritability. 2. Long-term chronic insomnia. Persists for weeks or months, sometimes even years. Can be caused by chronic stress, anxiety, depression, medical conditions, or lifestyle habits like irregular sleep schedules. Chronic insomnia can seriously affect overall health, including immune function, heart health, and mental well-being. How insomnia affects you. Insomnia doesn't just mean feeling tired. Its effects are wide-ranging. Mood changes, increased irritability, anxiety, or even depression. Cognitive impact, poor concentration, memory problems, and difficulty making decisions. Physical health, fatigue, headaches, increased risk of heart disease, high blood pressure, obesity, and weakened immunity. Energy levels, daytime drowsiness, low motivation, and decreased productivity. Common causes of insomnia. Stress, work pressure, financial worries, family issues. Mental health conditions, anxiety, depression, PTSD. Lifestyle factors, irregular sleep patterns, excessive caffeine, alcohol, or screen exposure before bed. Medical conditions, chronic pain, asthma, acid reflux, thyroid disorders, or neurological issues. Medications, certain stimulants, steroids, or antidepressants can disrupt sleep. Symptoms of insomnia. Difficulty falling asleep at night, waking up frequently during sleep, waking too early and being unable to return to sleep. Daytime fatigue or sleepiness, irritability, mood swings or anxiety, poor in concentration or memory, headaches or gastrointestinal discomfort. Diagnosis of insomnia. Doctors usually start with a detailed medical history, asking about your sleep patterns, lifestyle, and stressors. Sleep diaries. You may be asked to record, in the MACDIV set, sleep times, awakenings, and daytime fatigue, questionnaires or scales. Tools like the Insomnia Severity Index can measure how severe your insomnia is. Sleep studies, polysomnography. Occasionally used if a sleep disorder like sleep apnea is suspected. Impact on health. Without proper management, insomnia can lead to chronic fatigue affecting daily performance, mental health disorders like depression or anxiety. Physical health problems such as hypertension, heart disease, obesity, and reduced store immunity. Treatment and management. 1. Lifestyle and sleep hygiene. O. Keep a consistent sleep schedule. O. Avoid caffeine, alcohol, and heavy meals before bedtime. O. Create a calm, dark, and cool sleep environment. O. Limit screen time 1-2 hours before bed. 2. Therapies. O. Cognitive behavioral therapy for insomnia, CBTI, is highly effective. O. Relaxation techniques, meditation, deep breathing, or yoga. 3. Medications. O. Sometimes prescribed for short-term use under a doctor's guidance. O. Usually recommended only if lifestyle changes and therapy are insufficient. Prevention tips. Stick to regular sleep and wake times. Manage stress through mindfulness, exercise, or counseling. Avoid long daytime naps. Make your bedroom a sleep-only zone. No work, TV, or phones. In short, insomnia is more than a lack of sleep. It's a disorder that can disrupt mental and physical health, productivity, and quality of life. Understanding its causes, recognizing symptoms early, and using effective management strategies can help restore healthy sleep patterns.